Through this video, I have tried to draw similarities with the outer space and retina. The outer space is full of unknowns, and any journey in the cosmos is fraught with unprecedented terrors, joys, and sense of accomplishment. Retinitis pigmentosa is the most common inherited retinal disorder with a worldwide prevalence of 1:4,000. Besides the classical feature of bone spicule retinal pigmentation, there can be phenotypic variants in the form of dust-like pigments, hyperpigmentation, and various patterns due to migration of RPE cells. This may sometimes lead to fundus picture mimicking our Milky Way galaxy, and hence the term retinal galaxy for this video. The aim of this video is to showcase a constellation of 3 challenging scenarios in patients of RP and their management. Just like any break in the Milky Way galaxy can lead to a collapse of our existence, a break in the retinal galaxy can rob the patient of residual vision in retinitis pigmentosa. A patient of known retinitis pigmentosa with central choroiditis scar had severe diminution of vision due to advanced grade cataract, with OCT showing macular hole with retinal detachment. Due to extensive chorioretinal atrophy, the macular hole was not discernible from the surrounding structures. Tricot was used to assist in removal of the thick sheet of posterior hyaloid. Next, BBG assisted ILM staining was done. And finally, the break or the macular hole was seen as a dark brown pit at the site of the anatomical fovea. But due to intense reflection from the choroid, the ILM was not discernible from the surrounding structures, and hence the site of ILM peeling initiation was also very difficult. However, the surgery proceeded with an intention to repair the break using flaps of ILM along with ERM, and hence a multiple pinch and peel technique was employed to lift the ILM flaps without damaging the underlying retina. Thus, with utmost care and patience, finally a wall of 360-degree ILM and ERM flaps were achieved to cover the break or the macular hole with the flaps and thereby stabilize the retinal anatomy. Towards the end, fluid air exchange was performed with sulfur hexafluoride gas injection, and the patient was asked to maintain prone posture for 5 days. In the post-operative period, the patient had good functional and anatomical recovery with a clear media, and on OCT we can see that the hole had closed with an attached retina. Just like the black holes in the space from which any particle or light ray cannot pass, the second patient of retinitis pigmentosa had cataract with a blackish lesion in the macula, which on OCT got to be confirmed as a foveoschissus with an extreme RP hyperplasia. Due to extreme chorioretinal atrophy, there was a ring of RP pigments at the level of the equator with posterior pole macular black hole. Following ILM staining, the surgery proceeded with an aim to do a fovea sparing ILM peeling for foveoschissus. Due to extreme RP hyperplasia, as in a black hole, here too the light wasn't getting reflected from the outer retinal structures, and thereby it was very difficult to discern the ERM and the ILM from the underlying retina. After several attempts, many breath-held spells, heart and throat movements, flaps of ERM and ILM were raised and left bunched up over the fovea. Towards the end, fluid exchange was performed and sulfur hexafluoride gas was injected. Post-operatively, the patient had a good functional and anatomical recovery with a flattened foveoschisis. In the outer space, sometimes asteroids can be seen surrounding the black holes, and this led to theory that black holes may munch on the asteroids. The third patient of RP through a hazy media due to thick PCO, macular RP hyperplasia was confirmed on angiography and OCT with atypical lesions over the disc. Following posterior capsulectomy, tricot assisted vitrectomy was done. The macular black hole was confirmed to be due to RP hyperplasia. However, there were very atypical asteroid-like lesions over the disc, which led to the suspicion of retained or dropped nuclear fragments. Wait a minute, just hold on. Unlike nuclear fragments, these pieces are not freely mobile and they are adherent to the underlying retina. So what to do now? The answer was leave them alone and let's investigate further. So the vitrectomy was completed and the case was closed. Post-operatively, there was a clear media with good visual recovery and stable macula. At this stage, fundus autofluorescence was done, which showed the disc lesions to be hyper-autofluorescent, the octa showing the lesions to be arising from the retinal nerve fiber layer, thereby confirming a diagnosis of retinal astrocytic hematoma. The overall diagnosis was changed to retinitis pigmentosa with RP hyperplasia along with retinal astrocytic hematoma type 2. Through this constellation of surgical videos, in the first case we can see that the break was successfully repaired, in the second case the black hole was flattened to prevent from exploding, and in the third case the diagnosis of asteroids were correctly established as retinal astrocytic hematomas, and thereby the retinal galaxy in cases of retinitis pigmentosa was saved.